Right now across Idaho, women are being denied their basic right for health care. This isn't just an issue of policy, but an issue of dignity and autonomy. Today, I will discuss why Idaho should pass a Women's Health Protection Act that denies any government restrictions against abortion services. This act was introduced to the House on August 8, 2021, and then soon later passed the House into the Senate October 24th, 2021 in the same year. This act is very controversial between both parties, and the Democratic side leaning towards more of the abortion services that women should have. And the other party, it just varies. Over the last several years, there's been debate about it. I'm credible to be talking about this because I've done several research on the topic of healthcare, abortion services, and how the services are done. As well as it was my senior project, my senior year, I chose it. I'm just very passionate about this topic and I've done plenty of research on it so far. Today, I will be presenting 3 reasons why the Women's Health Protection Act should be passed and what it will do for Idaho. Number 1 being it will decrease the amount of unsafe abortions that are happening, as well as the increasing rate of teen pregnancies. Despite the opposition's claim, abortion is not murder. Shifting our focus to the core of the argument, we can now explore the pivotal role that Women's Health Protection Act will have on Idaho, particularly in lowering the unsafe abortions. If abortion access keeps being denied, then more and more unsafe abortions that will keep happening, increasing every year. Researchers have found that if abortions are unprohibited through the United States, the overall number of maternal deaths will raise by 24%. Also, according to Lisa Spitzer and other health officials, every woman should be able to have a healthy pregnancy, birth, and postpartum period, but at the same time, banning abortions for women will only do the country worse because it will raise more maternal mortality and morbidity. Banning abortions won't stop people from trying to end them themselves. They'll just do it in more drastic and harmful ways to their body, which then leads to more serious health issues, and sometimes it can lead to death. According to World Health, there are over 25 million unsafe abortions worldwide recorded. This was recorded in 2014 and through 2010, and more will keep happening if this health is restricted. A solution is that enabling women to make their own confident choices about their body, anatomy, everything in between, and especially having that choice to decide if they want to have that financial hardship after the pregnancy. When the health is restricted, they don't have that choice anymore. Turnaround studies show that women that are access to abortion are less likely to experience financial hardships compared to the women that are denied abortion, are seen to have more poverty, less public assistance, and poorer life health when they grow older. Maternal deaths will lower by 30% to 40%, especially for the people of color, if abortions are accessible to them. People of color are at the highest risk for this, so it is top that they get the help that they need. Women that are keeping unwanted pregnancies lead to more deaths, mental and physical struggles later on in life. Now that we have dived into how unsafe abortions can be prevented, also it protecting women's health and their financial hardship that can be avoided, we now can move to the societal impact with the teen pregnancies and the challenge that they face. With abortion services not being available to teens, more and more teen pregnancies are happening. According to Children Trends, teens only are accounting for 6% of the 9% of abortions that are happening, compared to in 2006, 12% to 17%. So you can see that there is a bit of a change in those numbers, one being older and the 2006 being the earlier ranked percentages. Women that are forced to keep their unwanted pregnancies are seen to have more, in turn, to more substances, alcohol, drugs, and that will lead to maternal depression, stress, and unfortunately, when the child is born, they're going to have more problems with their earlier development stages. When children are born from unwanted pregnancies, they are seen to have more behavioral and psychological problems in studies that have been studying the children from unwanted pregnancies. It's been shown they just have more struggles in adolescence. Teenagers are more likely to get abortions than any older generations, especially just because they're so young in life. They just want a future ahead of them. 1 in 4 pregnancies with teens end in abortion. Without these abortion services available, those struggles could happen to them. A solution is ensuring that access in Idaho is there for those young women, improving their lives, their future, supporting their health, and their societal benefit. Women's Health Protection Act provides a right for free healthcare free from restrictions by providing access to abortion services, as well as people with health risks. It can all be inverted just by respecting people's need for certain health care. Now that we have discussed how to avoid unsafe abortions and the rising rate of teen pregnancies, we can now address the common misconception about abortions. The common misunderstanding is that abortions constitute murder. It oversimplifies the complex ethical, medical, and legal considerations when it comes to abortion. We can use evidence to see this. When the egg is first fertilized, the embryo is divided into cells, and not until that week 9 it is considered a fetus. And when the abortion services are happening, it's between when the egg is fertilized to week 8. So right before the embryo and cells turn into a fetus. Abortions are a safe and legal surgery performed by trained officials. Not all the time does it have to be surgery. It can be a pill, a series of pills, it just depends. Women should be able to decide their own fate about their health, sexuality, reproductive health, and especially the life-changing ones that will affect the future. Second, implementing Women's Health Protection Act will do more good than bad. Making decisions for women is not a good choice for the state. Allowing them to make their own decisions about their body, anatomy, and their future life, and the financial hardship that they can avoid will do them so much greater. It will also enhance the health care and respect that this state will have. According to the Women's Health Protection Act, it establishes a statutory right for health care professionals to provide an abortion care for the right for their patients to receive, free from any medical restrictions. 479 abortions restrictions happen over 33 states. And professionals say that this is one of the most safest operations and procedures that can be done. It is important to reflect over the overarching implications of the argument and how it aligns to the values of the anatomy, health, and justice. Women's Health Protection Act, more specifically H.R. 3755, essential legislation that Idaho should pass for the access to abortions. Women's Health Protection Act will help solve the issue of the rising rate of abortions, unsafe abortions, teen pregnancies, and despite the opposition claims, abortion is in no way murder, but the healthcare choice for women. Granting women this right to make decisions about their bodies is not just a matter of health, it's a fundamental right. Passing Women's Health Protection Act, Idaho, can protect this right for women's anatomy, dignity, and health. Let us not fall behind in this pursuit of equality and justice. It's time for Idaho to lead with compassion and evidence-based policy.